Are your bones strong enough? Let's talk about when you need to get your bone strength tested. Hi, I'm Dr. Knight and welcome back to Getting On, the series where we stop worrying about getting old and just start getting on. I'm putting together a bone health series, so welcome to talking about everything bone health. And if you haven't done so already, I recommend watching part 1 of this series, where it gives you a bit more background and context into what bone health is and some of the terms that we might be using today. If you haven't watched it though, don't worry, we will go over most of the things in today's video. Today we're talking specifically about when we need to worry or start thinking about our bone health and when we might need to get our bone strength and bone density measured. So just a bit of a reminder, why do we even care about our bone health? Well, our bones need to be strong, dense and resilient to do all the things they're meant to do. So we need our bones to keep us upright, to support us, to absorb shock, and most importantly, we need our bones to not break. The worry as we get older is that our bones can potentially become much thinner. And when our bones are thinner, it can lead to something called fragility fractures. Now, fragility fractures aren't just the kind of fracture that you get from a big trauma, like if you get hit by a car or knocked off your motorbike. Fragility fractures are things that can happen from a really low impact injury. For example, you can even break something just from falling off your chair. Typical fragility fractures are of your wrist, your spine or your hips. So as you can imagine, especially as we're getting older, any of those fractures can really have a big impact on our life. So that's why it's really important that we try to avoid them. I'm using some really useful resources for today's episode and I encourage you all to go and have a look yourselves. So there is the Royal Osteoporosis Society, there's the National Osteoporosis Guideline Group called NOG. I also use something called NICE UK and also NHS England. Some of these are a little bit wordy, so if you can't be bothered to read any of those, then my videos will hopefully summarise their guidelines, but they do have some really good patient resources and I'll put the links in below, so I do encourage you to go and have a look yourself as well. So when should we start worrying about our bone health or our bone strength? The fact that you're watching this video suggests that you're already a little bit worried or thinking about your bone health, which is a good place to start. I don't want you to worry though, and hopefully I can alleviate some of your concerns and answer some of those questions you've had for a little while now. From the day we're born, our bones are constantly being built up and broken down and built up and broken down to make sure that our bones renew all the time and stay nice and strong. But from the age of about 40, we start to lose more bone than we build up. And the structure of the bone itself also starts to change. It becomes more porous with more holes, and that means that it becomes thinner and more likely to break. That's where the issues of osteopenia and osteoporosis come in, which is basically the thinning of the bones and then even more thinning of the bones to then lead to these things called fragility fractures, and that's what we're trying to avoid. Technically, we should always be worried about our bone health, and actually throughout our whole lives, we are always doing things, subconsciously or consciously, that are contributing to our bone health. So even from when you're born and you're a child, the more activity you do, the more calcium or vitamin D you have, the more jumping down from trees, the sort of shock absorption to your bones, all of those things when you're a child actually start to encourage good bone health. Obviously, it's too late to go back to your childhood and change any of those things now, but then actually going into adulthood, there's lots of things that influence our bone health as well. So for example, whether you smoke or not, because smoking can make your bones thinner, how much alcohol you drink, because alcohol can make your bones thinner, and lots of other factors like if you take lots of courses of oral steroids or if you have a low BMI. So there's lots of different things into our adulthood that can affect our bones. So I guess what I'm trying to say is that our whole lives influence our bone health. But when should we start thinking more about our bone health specifically? I guess I would say that for women who have gone through the menopause and for men over 50, that's kind of about the time you might want to start thinking about whether you need to have your bone health assessed. There's actually a few different steps when it comes to thinking about whether you should have your bone health assessed. So essentially, we need to identify, so doctors and yourselves need to identify those people who are at risk of having osteoporosis and of having fragility fractures. Those categories of people are all women over the age of 65 or all men over the age of 75, or women who have gone through the menopause or men who are over 50 who have one or the other of different risk factors. So some of these risk factors include having a parent who's previously had a hip fracture, smoking, taking lots of steroids, having a low BMI. There's lots of other different risks, but essentially if you're a postmenopausal woman or a man over 50 and you have one of these risks, or you're a woman over 65 or a man over 75, that all puts you in the category of when we should think, oh, actually, we need to look into whether we need to have a bone density scan. So if you're in one of those categories, you will have been identified as somebody who might be at higher risk of having a fragility fracture. But it's important to know that if you are in one of those categories, it doesn't necessarily mean that you have to go on to have a bone density scan or to have your bone strength investigated. First of all, what we do is we put you through a quite detailed risk assessment to establish whether you're low, intermediate or high risk of having a fragility fracture. Now, it's best to get this done by your GP or healthcare professional. And if you have identified yourself as one of those categories, and just to remind you, those categories are women over 65, men over 75, or postmenopausal women or men over 50 who have an extra risk factor. So if you're in one of those categories, I would prompt you to speak to your GP non-urgently about having a FRAX score. So a FRAX score is what we use, it's a tool that we use to identify those at risk of having a fracture. Essentially, you can look it up yourself. If you just type into Google FRAX score, University of Sheffield, that's the tool that we use. You can see that you have to input lots of data, including your weight, your height, whether you've taken steroids, whether you've smoked before, lots of other different things, and that will give us a score and a probability. And that probability will tell us how likely you are to go on in the next 10 years to have a fracture. So they will do your FRAX score, and that will identify you as either being low risk, intermediate risk or high risk of having a fragility fracture. If you're low risk, you will essentially be given lifestyle advice as to how to keep your bones nice and strong. If you are high risk, you will immediately go on to be offered treatment for bone thinning. However, if you're in that intermediate category, you will then be offered to go on to have a bone density scan or a DEXA scan. So what is a DEXA scan? A DEXA scan is basically a bone scanning machine that measures your bones to see how strong or how dense they are. You essentially lie on an X-ray like table, and there's a scanning arm that goes over your body and scans your bones. You can do this either in your own clothes, or you might be given a patient gown to wear. Importantly, you just can't have any metals or clips because they'll pick up on the scan. It basically uses a really low level amount of X-rays and goes up and down your body and scans your body, and it's less X-rays than in a normal chest X-ray, so it really is very safe. It's painless, it's quick, and it only takes about 10 to 20 minutes. Once the scan's done, the results will then be sent to your doctor or to whoever it was that ordered the scan in the first place. Your doctor will be able to then see your bone density, and based on your bone density, they will decide what to do next. So either your bone density is absolutely fine, your bones are nice and strong, you can just carry on doing the normal lifestyle advice to keep your bones healthy and strong. Or if the DEXA scan has identified you as having really thin bones called osteoporosis, your doctor will then discuss with you treatment options, and we'll discuss those in another video. So let's summarise when you should start worrying about getting a bone health assessment. First of all, if you are in one of those categories that I mentioned earlier, so a man over 75, a woman over 65, a postmenopausal woman or a man over 50 with one extra risk factor for having a fracture, if you're in any of those categories, we need to start thinking about performing a FRAX score assessment for you to categorise you into either low, medium or a high risk of having a fragility fracture. And then if you're in that intermediate category, you're the person who needs to go on to have a bone density scan, aka a DEXA scan, and that DEXA scan will have a proper look at your bones and assess whether or not you need to be started on treatment to keep your bones nice and strong. So in summary, it's really important to look after your bones. This process I might have made sound a bit complicated, but hopefully I've kind of broken it down a little bit more for you now. And remember, the whole reason why we're doing this, better, stronger bones means that they're less resistant to break and means we're not at risk of having those fragility fractures, which can be really detrimental as we get older. Thanks for watching, and I'll see you in the next episode of Getting On.